Hello, my name is Jessica Calhoun, and I'm a fellow at the Center for Digital Strategies at the Tuck School of Business at Dartmouth College. I'm pleased to welcome Yasmine Winkler, Chief Marketing, Product, and Innovation Officer at the UnitedHealth Group. She is here today as part of the Brit Technology Impact Series focused on healthcare's new network. So we really appreciate you being here, and welcome to Tuck, Yasmine.
Thank you for having me.
So how has technology impacted your role at the UnitedHealthcare Group?
Technology has a far-sweeping type of impact with regards to how providers are actually utilizing technology, how we would expect them to use technology so that we can continue to improve their efficiency and effectiveness, how we engage with our consumers and members in all of the various ways that they typically do other things that may be commonplace for them, like banking and looking up information and other transactions, apply incredibly well to the healthcare industry as well. And I would say that we're probably a little behind everybody else, and so it's really interesting how that's kind of taking shape as we move forward. As well as with employers and consultants and brokers and the rest of kind of the healthcare industry landscape, there is a high demand for being able to use the technologies that we use every day in those situations as well, from a communications perspective and engagement perspective. So there is an incredible impact that is happening right now.
Yeah, and so how do you think the technology is sort of going to continue to impact this space?
I think there'll be more with regards to especially integration, because I think some of that is not really seamless right now. So we have lots of solutions for kind of a very specific type of transaction or engagement, but I think what people are looking for is a seamless integration that makes it very easy and personal for them to engage in a whole variety of ways. So I think that's true for every constituency that we serve and that we interact with. And so I think that'll be an interesting set of innovations that will come as a result of that. So we, for example, have our own mobile app platform, and that's all really derived from everything that you've ever seen with regards to apps, right, in the last few years.
Yeah.
But it is all about putting in the hands of our members the ability to have an ID card, or for them to be able to look up to see if there's a provider that's in the network, or if they have to go to an urgent care facility, or what do they owe. So all of those things that you see in your daily life in a lot of other ways are really kind of being transported into the healthcare delivery system as well.
So the platforms and the integrations that you talk about, a lot are coming out of UnitedHealthcare, but how do you look to other innovators or other technology companies to sort of think about how to grow those platforms? Are there innovators in the space that you guys are looking to or working with to try and reach your members or your consumers?
Yes, because there's no way that we can build all of that on our own, and why would we want to, right?
Yep.
So one of the things that I talk a lot about, and you'll hear me talk about a little bit later, is all about the adjacent possible, and what's very much how innovation actually works from an adjacency perspective. So when you think about anything that you use today, it is not about that single thing that you look at, whether it's your cell phone or your tablet or even your laptop. It is about all the different innovations that it took to build that, and how that creates additional adjacencies within the actual industry and system.
Yeah.
So from our perspective, we want to be able to partner with retailers and all sorts of other entities, as well as work with little startups that have unique types of solutions that we think we can leverage in a different way within our own organization. So we are working in a whole variety of ways with the entire market landscape in order to be able to derive solutions for not only the system, but for all of the people who are our members and our customers.
Great. And so when you think of Google or Apple, there's obviously a lot of buzz around Apple's sort of health book, and thinking about how that will impact your industry. Do you see that as sort of a good for all, or do you see that as sort of a threat for some of the things that you're
I think we see it as a good for all. I think it will continue to propel us forward. We are, in many instances, working together with many organizations with regards to the data that we can provide as an organization, because we have a lot of data. Yeah. And so as a result of that, I think we're a really good business partner for many of the organizations that are really trying to make strides within the healthcare delivery system. There's a lot of work to do. It's going to take a lot of us to be able to solve the kinds of issues that we face.
Absolutely. When you are thinking about data, how are you using things like wearables to inform a lot of the platforms that you're looking at for UnitedHealthcare?
So this year, one of the things that we did was to participate in the Consumer Electronics Show. This is our 4th year participating there as a carrier, and they have a digital health summit now that they have created because there's an incredible amount of interest. You would not believe how many wearable devices there were, wearable clothing that have devices embedded in them, and it isn't just about your activity with regards to how many steps you took or calories burned. It's also about having a portable EKG. It's about your blood pressure being monitored. So there is an incredible amount of data that's being created from that. And what we have seen that we have been able to utilize already is being able to get a data feed to then say, okay, so Jessica has an incentive that if she is able to have activity at 10,000 steps per day for 3 days out of the week, you actually earn points as a result of it that your employer has sponsored. So we are getting those kinds of data feeds to be able to then pay out that incentive. We're also able to give some of that data then to your provider as well. So that data manufacturing is going to have incredible impact as we move forward. Lots of data being created from those wearable devices.
And do companies, when you work with employers, do companies really see a value? Because you see a lot of companies who really want to start to reward their employees for a healthy lifestyle through their healthcare providers. So are you working with a lot of companies around innovations there? Are they sort of pushing you guys to be innovators in that space?
I think what they're looking for is for us to be able to do something with it, right? So we're looking to integrate with all of those different organizations that have created wearable devices and be able to get data from them so that we can then formulate what our strategies are with regards to how do we actually incentivize someone for having done something? How does it actually become part of their record, especially when it's a blood pressure monitoring, so that the physician has a data feed for their patient that they normally would never have, right? Unless the patient came in for a blood pressure check. So that's the expectation, is that it's not just about the data, it's about the utility of the data and the information that it creates. That's really where the power, I think, really resides, and something that is not really completely tapped yet.
Yeah. And so with the Affordable Care Act requiring these electronic medical records and thinking about how you're having all of this individual-based data from your platforms, how are you sort of thinking about using that? How has that impacted your industry?
I think that one of the things that I've heard, especially in my last 5 days here, from a whole variety of providers and clinicians that really represent a whole variety of organizations as well throughout the U.S., is that we need a single platform for electronic medical record. We need to be able to get some real energy around being able to create kind of a single system so that we can all integrate with it in a whole variety of ways. But because right now that is very fragmented. And so I think that there's a push for us, our organization, to be part of the solution architect with regards to how do you actually create a single electronic medical record that can be used by all. Because I think that there's a lot of power behind that, but we haven't been able to all effectively come together to really do that yet.
Yeah. And so to that point, what sort of in your role now keeps you up at night? What are you thinking about that you're really trying to solve?
I think what I'm really trying to solve for is how do we make the healthcare delivery system incredibly simple for the consumer. It is so complex to navigate. It is not something that's intuitive. When I think about my 23-year-old who comes to me every time she has a medical issue, but when she's been on her own away at college, very complex for her and not something that she's familiar with and really understands how to utilize. Well, if you think of all the folks that are now newly eligible under the Affordable Care Act who have never really interfaced with the healthcare delivery system in a formal way. They've gotten a lot of emergency room care, but not necessarily primary care physician care. We need to figure out how to take the complexity out and make it really simple for them to access their benefits and access care in a responsible manner. And so I think that there's a lot of work for us to do around that. And that does keep me up at night because this is complex beyond imagining right now.
Yeah, and to that point, when you're thinking about data, how much data for the consumer is too much data? And how much information, thinking about as an individual, your daily sort of health stats, you're not really tuned into those, or you or I currently are not tuned into those. So when you're thinking about the perfect sort of solution for the consumer, what are you thinking about in terms of data?
We're thinking about the fact that it needs to be very personal. So I don't think that you'd appreciate us throwing a whole lot of information at you that isn't really about you and that you don't care about, and that, you know, if you don't have children, it's not important to you. If you're not pregnant, it's not important to you. If you're not suffering from a major life-threatening disease, it's not necessarily important to you.
Yeah.
But maybe you want to know what your last cholesterol level was, or your last BP, or what would be, you know, healthy fruits, or whatever those things are that are really appealing to you. Being able to personalize what gets brought up when you actually come into, for example, myuhc.com, which is our website, is really important, because that actually, you set what's enough. You set what is going to be too much for you that you're not really interested in or care about. So I think it's a very personal thing. I don't think there's a one-stop shopping or a one way to do that. But I do think that one of the things that we need to keep in mind is that every time we're using an app, or we're on our phone, or we're on our tablet, or we're on a website, there is data that is being generated from that. Data that we don't even really understand, and we don't know where it all goes either.
Yeah.
So as a consumer, we have to actually be responsible for understanding where that data is going to end up someday.
Yeah, absolutely. Yasmine, on behalf of the Tuck School of Business at Dartmouth College, I really want to thank you for participating in this interview and for a lot of your insights on the healthcare space. This has been Jessica Calhoun for the Center for Digital Strategies at the Tuck School of Business at Dartmouth College.